Friends, have you ever experienced this, that there is a constant sound that's coming within your ear without any external source? Well, in that case, you might be suffering from a condition which is called as tinnitus. Tinnitus is a condition in which you will be experiencing sound that's constantly playing inside your ear. This sound has no external and can be experienced at varying degree by different individuals. This sound for few people sounds like ringing, for few like roaring, and for few like buzzing sound. In all of these scenarios, the condition is called as tinnitus. Many of the people experience this sound even while moving their head or else their eyes or else rotating. And people who have got facial paralysis or Bell's palsy experience this noise whenever they do any kind of facial movement, extreme facial expression or even jaw movement. In all of those scenarios, tinnitus is the core problem that exists which requires treatment. So let's first understand what exactly is this tinnitus, why does it happen, and then we'll also try to understand what can be done to reduce or minimize this tinnitus. Because unfortunately, tinnitus is a condition which does not have a permanent cure. So let's start with understanding tinnitus. Tinnitus is a condition that usually happens due to an abnormal sensitivity to the ear. This happens due to multiple causes. Some of the causes that majorly lead to tinnitus is number 1, prolonged exposure to loud noises. People who spend lot of time in front of areas which has got loud noises like railway stations or else on roads, or army personnels who are constantly involved in fighting war. These rifle sounds, this loud noises increases the sensitivity of the ear and could lead to tinnitus in later stages of life. That's not all. The second common reason for tinnitus to develop is ear infection. People who have infection in the ear are likely to experience tinnitus some or other time. There are certain medication where with the prolonged use of that you might get tinnitus as its side effect. Majorly non-steroidal anti-inflammatory drugs like painkillers, ibuprofen, etc. have found to cause tinnitus, and the reason we should always avoid frequent use of pain medication as it can lead to tinnitus problem. The next common reason due to which an individual can experience tinnitus is accumulation of ear wax. Many times people get a lot of accumulation of ear wax which gets dried up inside the ear itself, and due to lack of removal it causes irritation to the ear slopes and which leads to increase in the symptoms of tinnitus. Even people who have got head and neck injury are also likely to experience tinnitus. There is one more very important condition in which tinnitus is very prevalent, and that condition is called as Meniere's disease. This is a problem where there is an increased fluid and the pressure that's falling on your ear area increases, the internal ear increases, which leads to increase in the symptoms of tinnitus. Even people who have got TM joint problem or jaw locking problem also are at likely risk of developing tinnitus. People who have got tumors in their brain or else around the ear region are someone who will constantly experience tinnitus more frequently compared to others. People who have got blood vessels related problem where there is thrombosis or else accumulation of clots, in that scenarios as well, that pulsating sensation constantly give them the feeling of tinnitus. And even some of the chronic diseases like diabetes mellitus, migraine, thyroid disorder, anemia, multiple sclerosis are some of the systemic disorders or condition which lead to the symptoms of tinnitus. So as you saw, tinnitus is a problem, a symptom which can be seen in multiple disorder, or you can say can happen due to multiple disorder. It eventually leads to impact in the quality of life. People feel that their ability to concentrate reduces. People feel their ability to focus on certain tasks and do that task in a more stable manner gets affected. People feel their balance ability also gets impacted due to this tinnitus. And the majority of problem that people with tinnitus experience is insomnia, because as the silence comes, the experience of tinnitus increases, which does not allow them to have a good quality sleep. And this all starts as a vicious cycle which leads to multiple other symptoms. And that's why it is very important to manage this tinnitus to an extent so that it doesn't impact the quality of life. The good news is tinnitus majority of time does not require any major treatment and resolves over a period of time. But in certain scenarios, it might require a very long-term management, a multidisciplinary management in order to bring it under control. Now let's understand what exactly happens in your ear which leads to this tinnitus. So as I mentioned, tinnitus is an perception of sound inside the ear. So definitely this will happen when there is a damage inside your ear. This inner ear changes the signals that are going from the ear to the brain. There is a disruption in the connection between the brain and the nerves that is carrying the messages from the ear to the brain. This lack of imbalance leads to the wrong perception of constant sound coming in the ear. Majority of the time, people feel that the tinnitus is starting in the ear, but in reality, this is a phantom sensation that is being felt due to lack of proper wiring between the brain and the nerve. So, the tinnitus is actually starting at the brain and not in the ear. And this area of the brain which gets affected, which leads to tinnitus, is called as auditory cortex. Now, as the brain is not a single structure, there are multiple areas or structures involved in the brain, and each structure talk to each other. So, whenever there is an abnormal circuit or abnormal response that's happening in your auditory cortex, this auditory cortex also communicates with your balance system, with your sensory system, with your motor system, and start getting affected. That's why the symptom, even though starts from ear, also lead to balance issues, also leads to muscle impairments like muscle weakness, tremors, difficulty in moving the muscles in the very smooth and coordinated pattern, etc. That's why tinnitus, whenever starts, requires to be addressed as soon as possible. So now let's understand what we can do in order to bring tinnitus under control. But before understanding what to be done to bring tinnitus under control, we should always identify from what source or what cause this tinnitus is coming from. Hence, the first advice that I would like to give you is, if you are experiencing any sort of ear sounds that is coming without an external source, see an ENT doctor as soon as possible. Get your ear examined so that there will be a proper diagnosis source from which this tinnitus is being generated. There are certain tests that your doctor will definitely recommend which will help him to identify the cause of tinnitus. These tests will majorly be a auditory or else hearing test. It will be a CT scan or MRI scan, and an ENT will also check internal ear for earwax accumulation or any infection being developed around the ear. So now let's move on to the treatment side of it. What can be done to manage this tinnitus? Here I am going to share with you the 3 most important things that you should do in order to keep your tinnitus under control. As I mentioned, tinnitus is something that is not 100% curable. At the same time, majority of time people don't need very major treatments for this. Eventually, with the time, they are able to manage the symptoms. So in order to manage the symptoms, the first thing and the most important and beneficial thing to be done is sound therapy. What do I mean by sound therapy? Here, the idea is to cancel the sound that's coming inside the ear by an external sound. This sound has to be soothed, it has to be constant and rhythmic in nature. That's why the best thing that you can do is take your phone, place it little away from you, and play a music of either a water falling in a very gentle manner in a stream, or else a sound of wind, or else sound of breeze, sound of light music. This kind of constant music will cancel out the sound that's developing inside the brain and ear. You can do this on a daily basis before you go to bed, that will improve your quality of sleep a lot. The good part is nowadays if you go to YouTube and just search for sound therapy for tinnitus, you will get many audio files that can be helpful for you. All you need to do is do some trial and error here and figure out which is that most soothing sound for you that is helping you out to cancel out that tinnitus. The second important thing that definitely you should work on is breathing exercises and relaxation exercises. Tinnitus, the constant sound that's coming inside the ear, leads to anxiety and stress related issues. This increases the symptoms of tinnitus, and that's why doing regular pranayama and meditation practices helps to reduce that anxiety level and thus helps in preventing and reducing tinnitus to a lot of extent. There are some maneuvers that are existent that helps in reducing tinnitus, but it will not be a right fit for all condition. So in upcoming videos, I will pick up every different disorders due to which there could be a symptom of tinnitus, and I'll also show you or demonstrate you some maneuvers that you can do in order to reduce that. Hence, make sure to follow this series in this month where I'm going to talk about all vestibular disorders. Let's move on to the next thing that you need to do, and that is called as CBT, Cognitive Behavioral Therapy. Results when it comes to tinnitus management. As I said, that tinnitus leads to a lot of emotional and psychological changes and also have a very negative impact on your ear perception of sound. That's why it is important that it is addressed over a period of time. Tinnitus will never come as a single problem. There will be multiple associated problems that will be there, and hence it will require a combination of therapies to do so. But in the case where you have been identified with infection in the ear, in that case you might require ear drops which your doctor will recommend. Ear drops which are antibiotics or else anti-inflammatory can help in certain scenario where the cause of tinnitus is figured out as an infection or inflammation in the ear, but might not work in the cases where the cause is not an infection or inflammation, or else it's just coming from lack of hearing loss, or else due to a Meniere's disease, or else due to a tumor that is present externally and causing pressure in the ear. Sometimes your doctor might also suggest you antidepressant and anti-anxiety medication to reduce the symptoms of tinnitus. But one maneuver that you can always do to reduce your symptom of tinnitus is this. Take your ear, pull this ear away and then release, come back. Hold for 5 counts, 1, 2, 3, 4, 5 and then come back. 1, 2, 3, 4, 5 and then come back. Same way you are going to hold the upper ear lobe, pull 1, 2, 3, 4, 5, come back. 1, 2, 3, 4, 5, come back. 1, 2, 3, 4, 5, come back. Same way, take your thumb, place it over the ear, press this pinna inside, 1, 2, 3, 4, 5 and release. But again, as I mentioned, this method might not work in all scenarios, but definitely there could be a temporary relief that you can achieve with the help of this maneuver. So make sure to try it and let me know whether it worked in your case or not. In upcoming videos, as I promised, I will come up with many more maneuvers and methods that will help you out to reduce your tinnitus symptoms. At the same time, I am going to talk in very detail about vestibular disorders. So if you are someone who experiences dizziness, vertigo, headaches, etc., then this series is definitely for you. So what are you waiting for? Haven't you subscribed to our channel? If not, make sure to subscribe it right away and follow us for this journey of vestibular rehabilitation. Thank you.